Hey there, fellow grad students. Test coming up on interpersonal psychotherapy. I have 10 practice questions for you. Ready? Let's learn psych fast. Question 1. Which question by the PMHNP would gain the most information from a patient experiencing a marital crisis? A. Do you hate your spouse? B. Do you get along with your in-laws? C. Do you talk about your problems with your spouse? Or D. What is it like at home with your spouse? The answer is D. What is it like at home with your spouse? To implement therapeutic communication, you should encourage the expression of feelings rather than a yes/no answer. Use of open-ended questions facilitates more open communication. Question 2. Mrs. R, the mother of a young schizophrenic patient, seeks you out and begins to cry. She expresses concerns over her daughter's behavior. Your best response to this woman is A. What is it that concerns you the most, Mrs. R? B. Well, that is part of the illness. C. Here's a book on schizophrenia. This will help you. Or D. Are you afraid your daughter will always be like this? The answer is A. What is it that concerns you the most, Mrs. R? The correct response is an open-ended to seek out more specifically why she is upset. Responses B and C will shut down communication. Response D is making an assumption of why she is upset. Question 3. What condition was interpersonal psychotherapy originally developed to treat? Is it A, depression, B, schizophrenia, C, OCD, or D, substance abuse disorder? The answer is A, major depressive disorder. So interpersonal psychotherapy was originally developed to treat outpatients with major depression. It can also be used for anxiety, PTSD, bulimia, and borderline personality disorder. Question 4. A patient states, I don't know what the pills are for or why I'm taking them, so I don't want to take them. What therapeutic communication would help this patient? Is it A, ask for what you need? B, silence? C, use general leads? Or D, giving information? The answer is D, giving information. So why? Given information, well, this can increase rapport, it can reduce patient anxiety, and it suggests patient collaboration. Question 5. To practice effectively in mental health, you should be able to A, solve his or her personal problems without assistance from others. B, comfortably point out the patient's shortcomings and provide advice about how to improve. C, bring patients and coworkers into compliance with societal rules and norms. Or is it D, demonstrate therapeutic communication? The answer is A, solve his or her problems without assistance from others. Good communication skills are essential for working in mental health. Good communication skills center around being able to promote open communication with such techniques as good listening, use of open-ended questions, and appropriate use of silence to be therapeutic. Question 6. What is step 2 in the 5 steps of the initial phase of interpersonal psychotherapy? Is it A, explanation of treatment, B, diagnose major depressive disorder, C, give the patient the sick role, D, identification of interpersonal problem area, or E, develop an interpersonal inventory? Really review that question if you don't get it right. The answer is C, give the patient the sick role. So there's 5 steps. Step 2 is to give the client the sick role, in which they are suffering from an illness and it's not their fault. During this, the therapist educates the patient on ways that depression can impair social functioning. Question 7. Interpersonal therapy is designed to treat acute episodes of depression and anxiety and typically lasts for how long? Is it A, 6 weeks, B, 5 years, C, 1 year, or D, none of these are correct? The answer is D, none of these were correct. For acute treatment, sessions typically last for 45 to 50 minutes over the course of 12 to 16 weeks. Question 8. The PMHNP is meeting with a patient who has been diagnosed with depression. The patient is having trouble adjusting to her new job and hasn't made any new friends there. What would be the appropriate response by the PMHNP use an interpersonal psychotherapy approach? Is it A, for homework, please write a list of qualities you'd find in a good friend? B, describe the friendships you have had growing up, both as a child and a teenager. C, tell me more about why you're having trouble making new friends at work. Or D, all of the above. The answer is C. Tell me more about why you're having trouble making new friends at work. So C is correct because interpersonal psychotherapy focuses on the patient's current life. A is incorrect because specific homework is not part of IPT. B is incorrect because IPT focuses on the present, not past causes of problems. And D, that's incorrect because C is only a correct answer. Question 9. A PMHNP is using Gestalt therapy to communicate with a 48-year-old patient who is going through a divorce. As he is calmly sharing the details of his divorce, the PMHNP notices that Jim is tapping his fingers on his legs. What is the appropriate response by the PMHNP using the technique of focusing? A. I noticed that your fingers were tapping. Can you give a voice to your fingers? B. I'm going to ask you to exaggerate the movement of tapping your fingers. C. Explore what is emerging in your body now. What are you experiencing right now? Or D. None of the above. The answer is A. I noticed your fingers were tapping. Can you give a voice to your fingers? So A is the correct answer because focusing is a Gestalt therapy technique used to deepen contact with alienated aspects of self. B is incorrect because exaggerated body movement is part of body awareness technique. C is incorrect. Asking Jim what he's experiencing in his body is also part of body awareness. D, it's incorrect because A is the correct answer. Question 10. A 38-year-old patient has been having trouble communicating with his teenage daughter. Using a solution-focused therapy approach, the PMHNP responds by saying, when was the time that a communication problem could have occurred, but it didn't? In this case, what type of question is the PMHNP asking? A, coping question, B, joining question, C, exception question, or D, miracle question. C is the correct answer because an exception question encourages the patient to describe what has been working in the past to make future improvements. A is incorrect because a coping question that includes a validating statement and questions about the patient's coping skills that have not gone unnoticed. B, it's incorrect because a joining question's purpose is to connect and accommodate to the patient's world. D, well, that's incorrect because a miracle question asks the patient to imagine a future if the problem was solved. All right, all done. Thanks for staying with us. Good luck on your test. Share with a friend.